Welcome back. We're in a series, the 8 areas of a full individualized evaluation. If we haven't met, I'm Mayer Cunningham, owner of Special Education Academy and Special Education Boss, training everyone that sits at the 504 IEP table to navigate and negotiate successful student outcomes. There's nothing more important than this foundational piece of special education than correct testing. And parents or guardians or surrogate parents or grandparents do not get correct testing because they don't ask for all 8 areas. So now we're talking about area 5, and that is going to be adaptive behavior. And so these are really important skills that I think are very often left out of an evaluation. Often we look at adaptive behavior in special education testing. We're looking because there's a consideration of an intellectual disability, or a student has a lot of functional needs, maybe a sensory deficit, maybe they are deafblind, visually impaired, or deaf and hard of hearing. However, we want to look at this foundationally in that initial evaluation so we have a baseline. There's 9 areas. I'm going to read them off to you because I don't want to miss any and I want to get them right for you guys. So when we ask for formal adaptive behavior, remember we're asking for testing. You can use the F word. We're going to ask for formal. We don't want informal. We want formal evaluation. So these rating scales are going to go to the teacher of record. If they're in elementary school and they have switch teachers, do both of those. If they're in the higher grades, you get at least 2 instructors and the parent or parents if they're in different homes. So the 9 areas, number 1 is communication skills. This area examines how well individuals can understand the use of language, both verbal and nonverbal. So we're talking about that listening, that speaking, that understanding, that receptive, that social emotional piece. Number 2 in adaptive behavior, self-care. This is going to evaluate the person's ability to perform basic personal care tasks, such as feeding, dressing, grooming, and hygiene independently. Number 3 in adaptive behavior is going to be social skills. This is so critical. This includes interpersonal skills, the ability to form and maintain relationships with their peers, with their instructors at home, and people that are their relatives, right? Number 4, home living skills. This looks at an individual's ability to manage household tasks like cooking, cleaning, and handling any of that personally or in a way that's safe. Next is going to be community use, the ability for that person to navigate and make use of community resources and services, such as public transportation, shopping, and participating in community activities. A lot of times in this area, we have parents that are really involved and their kids are out in the community, but based on the acuity of their disability, they might have been homebound or hospital bound and not have access to that many. Number 6, self-direction. Self-direction, this involves evaluating one's ability to set goals, make decisions, follow through with plans, and exhibit self-management and problem-solving skills, right? That really looks at that piece, that fluid reasoning, that ability with automaticity to know what to do next in novel situations. And number 7, health and safety. This covers knowledge and practices related to staying healthy and safe, including understanding health needs, avoiding dangerous situations, and knowing what to do in an emergency. A lot of our kiddos, based on the acuity of their disability, are not aware of things that would be dangerous to them, things that are indicated that are poisonous, things that are indicated that this area is blocked. So those would be important things to know. Number 8, functional academics. So this is going to assess practical academic domains, skills necessary for daily functioning, such as reading, writing, and basic mathematics that are applied towards everyday tasks, functional academics. And then last but not least, leisure and work. This examines how individuals use their leisure time effectively, engage in recreational activities. Their ability to work include job-specific skills and maintaining employment. And so, again, usually the school district is going to look at that area foundationally as an initial evaluation. I would always ask for it for an initial evaluation. I would ask for it if a child has an onset need, if there's a new eligibility, especially in the sensory area, in vision, hearing, functional, ambulating. If the student has an onset medical condition, such as seizures or epilepsy or Tourette's, those things, those medical conditions can greatly impact an individual's ability in the area of these adaptive behavior skills in all 9 areas. I hope that was helpful. We'll see you guys in the next training.